Hello, brother and sisters. Today I would like to present the project to solve the problem of maternal death health issue in the Afghanistan. Afghanistan have very high maternal mortality rate in the world, and if I define this problem in detail, then I would say is that the maternal death mostly occurs in women aged between the 20 to 29 years old, and it mostly occurs in remote to the urban areas. And so the high maternal mortality rate is, have been seen in Ali Singh district, Lakeman province, Mewant, Kandahar province, Rag and Bakshan province. And the maternal death mostly occurs during the pregnancy period. And when I tried to find out the causes of the maternal death, then I found that the poor access to the healthcare, the version, and the cultural barriers to the access to the healthcare are biggest concerns for high maternal mortality rate in Afghanistan. We can also detect the relationship between the social determinants of the health and the maternal death. I found that we can divide these factors on the four level. In the first level, the individual level, poor knowledge about the maternal health services, poor socioeconomic status. There is illiteracy among the women in Afghanistan. These are the factors works on the individual levels, and you can see the very high maternal mortality rates among the women who have these factors. If we see the factors on the organizational level, then I found out that only the 40% have access to the healthcare. Only the 10% hospital have a facility for the tertiary care, I mean for the cesarean sections and the treatment for the complication of the pregnancy. There is no enough trained staff, so these are the factors works on the organization level which have a relationship with the maternal death. I means that there is a high maternal mortality rates. If we see the factors on the community levels, then I found that there is a lack of the communication between the primary health care and the tertiary care. There is also the lack of the support from the community members, and there is no education campaigns in the communities regarding the maternal and child health. So these factors works on the community levels for the poor maternal health in Afghanistan. If we see the factors on the policy levels, I consider that the poor political commitment for the maternal and child health, the poor social policies, and the inferior budget for the healthcare are the responsible for the poor maternal health in the Afghanistan. Let's go to the next slide. I try to find out the solutions to improve the maternal health in the Afghanistan, and I found the three evidence-based interventions that we can implement in the Afghanistan to improve the maternal health. And these are the interventions which directly address the major causes of the maternal death in the Afghanistan. Let's discuss the individually. In the first evidence-based interventions, I would suggest the access to the prenatal care. If we provide the prenatal care at every primary health centers, then we can improve the maternal mortality rate in the Afghanistan. The World Health Organization data suggests that even the woman receive the minimum 4 visits during the pregnancy, the outcome would be the same as the woman visit the more than the 4 visits in developed country. So this is the good interventions to implement to improve the maternal health in Afghanistan. The second interventions I would suggest the supplemental calciums during the prenatal care, and one of the research suggests that the calciums help to protect the uh, pre- help to prevent the preeclampsia cases in the woman during the pregnancy. And I also detected that the preeclampsia is one of the major causes of maternal death in the Afghanistan. So this is also one of the good interventions which directly address the cause of the maternal death in Afghanistan. Third intervention, I would suggest the prescription of the misoprostol to the woman who, when the institutional care is not available nearby. Misoprostol is a medicine which help to prevent the postpartum hemorrhage uh, in the woman. So I would suggest that we can prescribe this misoprostol medicine to the woman who cannot have access to the hospitals during the emergency like a postpartum hemorrhage. Let's go to the next slide. How we going to evaluate this evidence-based intervention? I would suggest that we can evaluate these interventions by doing a survey before the implementing the interventions and after implement the intervention. And my target would be a reduction in the 35% cases of the maternal mortality rate if we implement the prenatal care in each primary healthcare centers. And I also hoping to improve the access to the healthcare to the 85% female populations in Afghanistan. Second interventions we can evaluate in the same way as we uh, we evaluate the prenatal care. And I am expecting to improve the 20% cases of the preeclampsia, as most of the cases happens in the remote area, and preeclampsia is one of the major cause of the maternal death in the Afghanistan. Third interventions we can evaluate similar way as we can do the prenatal care, access to the prenatal care intervention. And I am expecting to improve the almost the 56% cases of the maternal mortality rate, the as postpartum hemorrhage is a number one cause of the maternal death in the Afghanistan. Uh, I also found that there is a potential barriers to the interventions, and in my list, they are lack of the community supports to educate the woman, lack of training staff, poor budget for infrastructure and staff, lack of quality prenatal care, lack of family support, and poor socioeconomic conditions of women, and corrupted political system. Uh, but I also have a solutions to remove these barriers. We can remove these barriers by providing a proper fund allocations for healthcare infrastructure and resources, um, by providing a prenatal care expert to train a grassroots level healthcare staff, regular arrangement of the training camp, education camp to educate all community members, and proper monitoring of intervention regularly. Uh, Here you can see the logic models which shows how what are the resources we need to implement these interventions, and what would be the input and what would be the outcomes of the whole project. So thank you very much viewing these projects and hearing me very patiently. Thank you very much once again, and I hope we can help to improve the maternal mortality rate in Afghanistan. Thank you, friends. Have a nice day.